Katy Fielding is the Assistant Director of Health Services Policy at DHHS. I asked her for a CV. She said, no one cares about the CV. I said, well, tell me something fun. She said, I'm a beekeeper. I said, okay. She's got 6 hives. I hope none of you live in East Bentley because they're all in her backyard. So you might get stung, but you'll get free honey. So please welcome Katy Fielding.
Thank you. And just in case there's anybody here from the Department of Agriculture, I don't have 6 hives in our back garden because that would be illegal. I have 2 and the rest are farmed out somewhere else. I just want to make that incredibly clear. I'll even overlook the wrong spelling of my name as long as you all remember I don't have 6 hives. So yes, I'm Katy Fielding. I'm here on behalf of Denise Ferrier. So she was on the agenda. So if you're really disappointed and you want to hear her and you want to leave now, I'll understand. But she has asked me to do this summation for her. I feel really honoured to follow Antoinette today and to acknowledge the rich culture, traditions and elders of Victoria's Aboriginal community, and in particular the traditional owners and custodians of the land that we're meeting on here today. The movement towards self-determination and the work of organisations such as the one Antoinette leads is an example to us all working in this field of the importance of connection to culture and community. And these connections are factors that contribute to the health, well-being and safety of us all. And it's important to reflect on our roles in the Strengthening Hospital Responses to Family Violence initiative within this light. In their findings, the Royal Commission into Family Violence emphasised a greater role for universal services in identifying and providing a first response for victims of family violence. We are building a system where those that experience family violence will know that they can attend any public health service and feel safe and supported to connect into the broader services that are available to support them. That's our vision. The Victorian public health system, though, is extensive and complex, and all Victorians will connect into it at some point in their lives, even if it's only when they're born. Now, the work we are doing is going to undertake a complete change in the direction for public health system to address the needs of women and families affected by family violence. As you'll be well aware, in health we are in a unique position to identify the early support to victims of family violence, as we're often the first point of contact. But making a huge shift such as this requires both individual and collective effort and action, as well as the introduction of things like antenatal screening, which is a very localised response. It's important that we have hospital staff have the skills, knowledge and confidence to be individually responsible and collectively contribute to the real change in people's lives. And by that, extend into the safety of our community, which of course includes our own staff. The vision of the Royal Commission was to build a connected, seamless service to support victims of family violence. And the Strengthening Hospitals Response to Family Violence initiative builds on that vision by bringing health services into this connected system. But it also allows us to respond to some of those other issues that may be apparent when family violence is also present, such as mental health issues, alcohol, drugs and disability. So the year ahead, I think, is one of consolidation and integration for this initiative. The first challenge that some of you will have to connect with is the new Orange Door family safety hubs as they progressively open across the state, and to develop lasting relationships with these services that will make up for that linked service. We should reflect, though, on what has already been achieved. And the department recently received the 2017-18 report collated by the Royal Women's Hospital in their role as the statewide lead for this initiative. One example is that the report shows that over 10,000 hospital staff have participated in training in 2017-18 alone, and we estimate that this brings the total number to about 14,000. This is a very significant number and highlights the momentum that's been gaining over the last 12 months. Although I suspect it's a little bit like painting the Sydney Harbour Bridge. You'll have to start again with the new staff coming in. We know that the health workforce is very large and mobile, so that work will have to have a continued focus and attention. It's also very clear that the support networks built by the Women's and Bendigo Healthcare as sector leads, regional health services the regional health services and the formal and informal communities of practice are making significant contributions to information sharing, innovation and the progressive development of the initiative. Your adaptability in the face of what is a unique undertaking has actually been quite profound, and this is reflecting a growing maturity of the initiative. As you've heard today, over the first half of this year, the Royal Women's has invested considerable resources in updating the toolkit. It provides not just updates to the third edition, but also significant additions to the suites of tools that will assist you in ongoing implementation, and we hope that you'll take advantage of these extensive resources. As many of you also know, the development of the updated Common Risk Assessment Framework has been underway for some time, with the new MARAM framework to be implemented alongside the Child Information Sharing and Family Violence Information Sharing legislation over the next few months. As a whole, the Victorian Government tool, the MARAM framework, will provide a cornerstone to a more connected and integrated system and ensure a shared understanding of responsibilities, risk and assessment. MARAM will also support our public antenatal services to implement routine screening for family violence with the confidence of an integrated system and referral pathways. So events like today are incredibly important. They remind us what has already been achieved, as well as confirming our commitment to continue the work. Importantly, they can connect us on a pragmatic as well as a conceptual level, and I hope many of you have made notes of people that you want to connect with after today to share and continue the shared learnings. The future is also about planning to move from project-based initiatives to having the responses hardwired into each staff member and each organisation through learning, reflection, and at times dogged determination and hard work. A key observation that's important to remember of the Commission was while there were pockets of good practice in healthcare, consistency was needed. This is always a challenge for us in healthcare in Victoria. We have 86 public health services hospitals, and it often feels like we have at least 86 ways of doing everything in health. Some of this is inevitable, given the differences in the size and roles of individual health services. But importantly, the work to implement a whole-of-organisation approach, that's Recommendation 95, provides the framework for this consistency, where consistency is important. How services operationalise their response will always depend on the context and local factors, but the outcomes we want for clients and the key elements needed to achieve that need to be uniform. This is momentous change, as you've heard many times today. We are all involved and we all have a role to play. I hope today has been both challenging and inspiring.